Hello everyone, this is Dr. Kajaree Giri, consultant nephrologist and renal transplant physician from Amor Hospitals, Kukatpalli, Hyderabad. Today we are here to discuss about chronic kidney disease. What is chronic kidney disease? What are the causes, risk factor, symptoms and treatment options? Also, what is dialysis? And lastly, what is renal transplantation? So, coming to the first question, what is chronic kidney disease? Kidneys, as we know, are two bean-shaped organs located in our body. Their main function is to filter the waste products in our blood and excrete it via the urine. Chronic kidney disease means it is a gradual and slow decline in our kidney function. In early stages, you may not even realize that the kidney function is declining. However, in advanced stages of chronic kidney disease, there will be buildup of the toxic waste products in our body and also increase in the fluid volume in our body, which will result in different symptoms. Now coming to what are the causes of chronic kidney disease. In India, we know that around 1 in 10 individuals are affected in chronic kidney disease. The most important and the most common cause in India is diabetes, type 1 or type 2 diabetes mellitus. Second common cause being hypertension or elevated blood pressure. Other causes may be glomerulonephritis, that is inflammation in the filtering units in the kidney called glomeruli. Also, interstitial nephritis, that is inflammation in the tubules of the kidney or its surrounding structure. Other causes like cystic kidney diseases like polycystic kidney disease or acquired cystic kidney disease can occur. Any congenital malformation of kidneys which are present since birth can lead to chronic kidney disease. Also, chronic obstructive nephropathy like chronic obstruction in the urinary tract, it may be stones or tumors or prostate or cancers can cause chronic kidney disease. Lastly, chronic medication overuse of over the counter drugs like painkiller medications or steroids can lead to chronic kidney disease. Now, coming to what are the risk factors of chronic kidney disease. As we have discussed, the most common risk factors is diabetes mellitus as well as elevated BP, that is hypertension. Other risk factors are obesity, any family history of kidney disease, any kidney disease from childhood, birth, and intake of over the counter medications like painkillers or steroids are all potent risk factors for chronic kidney disease. If we have any of the comorbidities or these risk factors, the doctors will advise for routine test and monitoring. Now, coming to what are the symptoms of chronic kidney disease. As we have told that chronic kidney disease is often slowly developing. So in early stages, the patients may miss the early symptoms, but kidney disease can affect every organ system of our body. So the usual symptoms, if we see, comes if we start from our brain, it will be depressed mood or irritability, anxiety, or behavioral changes, personality changes, and in severe stages, even seizures can occur. Apart from this, the most common symptom is fluid accumulation in our body. That is, there will be swelling in the limbs, hands, or the legs. Thirdly, we can get shortness of breath or pulmonary edema, that is, fluid accumulation in our lungs. Similarly, we can get increased in chest pain, palpitation, or cardiovascular symptoms due to fluid accumulation in our heart. Also, there is generalized weakness, fatigability, muscle pains can occur. Patients often report of nausea, vomiting, decreased appetite. There will be decreased sex drive and infertility symptoms can occur. Also, the patients will have depressed immunity. So, increased risk of infections can also occur. As we are stressing repeatedly, in early stages, the symptoms are very mild and diffuse, so generally it is overlooked. But in advanced stages, there will be increased symptoms as mentioned seizures, shortness of breath, chest pain, or severe fatigue, weakness, anemia, bone pain, and also increased risk of fractures. So coming to the next question, when should we consult our doctors? So firstly, if you have any of these symptoms, you can consult the doctor, and if there is any of the risk factors or comorbidities, you should do routine monitoring of blood test and urine test. Now, what are the ways to diagnose chronic kidney disease? When you visit your doctor first will take a history of your kidney health. It will include questions like you have any comorbidities like hypertension, diabetes, or any chronic use of medications like steroids or any painkiller medications or over the counter drugs. After history taking, the doctor will do a physical examination of your body, check your BP, sugar, pallor, that you have any anemia or not, or any swelling in your legs or not. Then the doctor will advise few blood tests that mainly includes the renal function test or the kidney function test, most commonly the blood urea and creatinine levels. This test gives a rough estimate on the level of the toxins or waste products in your body. It is often determined to test a factor called eGFR, that is estimated glomerular filtration rate. We have to keep in mind that this eGFR indicates the level of kidney functioning, and it will vary from patient to patient because it depends on the age of the patient also. After the blood test, the doctor may prescribe some urine tests also. These urine tests are used to see whether your urine is leaking any protein or blood from your body. Also, it is there to see whether there is pus cells or infections in your urine, because chronic infections or chronic pyelonephritis is often a frequent cause of kidney failure. After this, the doctor may prescribe some imaging tests like ultrasound kidneys to see the kidney size, location, and the ecotexture. Also, it is done to rule out any renal stones, calculi, or the prostate size. Lastly, in few cases, the doctors may also prescribe to go ahead with kidney biopsy. Kidney biopsy is a bedside procedure which is done where a small piece of sample of kidney is retrieved. It is done under local anesthesia, and a long thin needle is used which is passed via the skin and the kidneys so that we can take a sample of the kidneys. It is a very useful test in few diseases, and if your doctors prescribe it, you can go ahead without any fear or hesitation. So after the diagnosis, let us come to know what are the complications of kidney failure. As I have told earlier, kidney disease can affect any organ system of our body. So, in the cerebral complications, we can have seizures, behavior change, personality changes, or even strokes and cerebrovascular accidents. In cardiovascular symptom, we have increased chance of heart attack or cardiovascular diseases, which is mostly due to hypertension. Refractory hypertension, that is increased blood pressure which is difficult to control, is a very common and frequent complication of kidney disease. We know that kidneys, apart from filtering our blood, also perform some important functions in the body, like maintaining our bone health and making our hemoglobin. So, kidney failure can result in anemia and also bone diseases which lead to increased risk of fractures. Apart from this, there will be decreased immunity in these patients, so there will be high risk of infections. So in all possible scenario, we should visit a nephrologist and get our kidneys tested before we land up in any such complications. Now we will come to our next section, that is how to prevent the kidney diseases. It is the most important thing because early detection and prevention of kidney diseases will prevent all the above mentioned complications. So firstly, we should have to control our diabetes or elevated blood pressure, that is hypertension, strictly. Take the help of your doctors to continue all the medications. We have to follow a healthy lifestyle with a proper diet. In diet, few points we have to note in chronic kidney disease. We have to take care of five things: the protein intake, the sodium, potassium, calcium, and phosphorus intake in our diet in patients of chronic kidney disease. Protein is very essential of our body. It helps in wound healing, it helps in formation of enzymes and various hormones. So, limiting too much protein may be harmful for our body. But increased protein intake, especially non-vegetarian protein, can increase the risk of waste products in our body. So often low protein diet is recommended in chronic kidney disease, but do consult your nephrologist and doctor before starting a very low protein diet. Second, salt limitation is of very importance in chronic kidney disease because increased salt causes increased blood pressure and also fluid retention in our body. We should avoid high salt diet and it should be less than 3 grams per day. Coming to potassium intake, food rich in high potassium like bananas, berries, orange or juices should be avoided in patients with high creatinine. Coming to phosphorus intake, food with high phosphorus like cheese, processed meat or dairy products are sometimes recommended to keep low in a diet of a chronic kidney disease patients. Normal diet containing calcium is recommended, but before taking prolonged calcium supplementations, your doctor should always be consulted. After diet, we should always remember for a healthy life with a normal BMI, that is exercises is very important for patients of chronic kidney disease. We should always target to avoid smoking or any other addictions, and we should stop taking any over the counter medications like painkiller or analgesics or long term steroids. Another point to keep our kidneys healthy is to drink plenty of water, and we should see our urine color daily. It should be light yellow or pale in color because too much high colored urine will cause dehydration in our body. Lastly, coming the what are the treatment options of chronic kidney disease? Coming to the treatment options, it can be divided into treatment of the cause of the chronic kidney disease, like there will be steroids or any other medications can be prescribed by your doctors if the cause is known. But the most common treatment options that we follow is to prevent the complications of the kidney disease and to keep the patients comfortable. It includes drugs like that control high blood pressure, a type of drugs which help to excrete the fluid from our bodies called diuretics. Drugs causing cholesterol lowering medications called statins can be given, and medications which helps to keep correct our anemia, improve our hemoglobin, and also medications which keep our bones strong are often prescribed in chronic kidney disease patients. Lastly, if the kidney disease is progressing to an irreversible or permanent stage, it is called end stage renal failure. In that case, dialysis and transplantation are the only options. Now, coming to the last segment of our discussion, what is dialysis? Dialysis is a process in which the blood is filtered artificially because our kidneys are unable to do so. There are two types of dialysis, hemodialysis as well as peritoneal dialysis. In hemodialysis, a dialyzer or a machine is there which draws our blood, filters it outside, and again transfuses the blood to our body. And it can be conducted at home also or in clinic centers. Discuss with your nephrologist which option is the best for use. For dialysis, we have to create a vascular access for which this procedure will be carried out. It may be in the neck, of a catheter will be inserted in the neck, or a perma catheter can be inserted, or the best will be fistula creation in our hand. Coming to peritoneal dialysis, it is also an effective option for dialysis. In peritoneal dialysis, our body itself acts as a filter which filters the waste products of our body. Here, a small catheter is inserted in our abdomen and we transfuse fluids called dialysate, which is kept in our abdomen. It filters the waste products and again it is taken out via that catheter. Discuss with your doctor or nephrologist which mode of dialysis is most suited for you if you need dialysis. Coming to the last option, what is renal transplantation? Renal transplantation is the only curative treatment for kidney failure because here we are transplanting a healthy kidney to the patient's body. Usually, the native kidneys or the damaged kidneys of the patients are not taken out until and unless there is severe infection or any other cause. Only the healthy kidneys are transplanted to the patient's body. A person has to take lifelong medications after renal transplantation, and it gives a patient a good quality of life also. In Telangana, we have transplant options under two schemes. One is cadaver donation scheme, that is Jeevan Dan scheme, and also life donation schemes. So friends, do regularly check your kidney health, and if there is any symptoms or any early problems, do visit your nephrologist so that permanent damage of the kidneys can be prevented. I wish you a good health and do follow our channel for more such updates. Thank you.